According to the CDC, every 40 seconds, someone in the U.S. may have a stroke. May is National Stroke Awareness Month, and joining us today is Jessica Hanna, a vascular neurologist, to help shed light on this critical health issue. Dr. Hanna, thank you so much for joining us.
Thanks for having me.
I do want to ask you, before we delve into the subject, what is the significance of National Stroke Awareness Month? Why is it so important?
Sure. It's a time that we like to remind the public the signs of having a stroke. Biggest thing being that when you are having a stroke, there's a small window of reversal available. So we like to make the public aware, what does it look like to have a stroke, so you can recognize and then go get treated.
And what are the symptoms that someone should look out for in themselves or a loved one if they think they might be having a stroke?
We like to use the mnemonic B.E.F.A.S.T. Because it reminds us both, yes, you need to be fast, hurry up and get to the emergency room so we can fix you.
Yeah.
But it also, each letter stands for a symptom. So the B in B.E.F.A.S.T is balance. If you suddenly have lost your balance, you are fine, you're not intoxicated. We all know what it's like to be intoxicated and lose your balance. But if you suddenly lose balance and you're not intoxicated, you don't really have a reason for it, that's concerning. That should never happen. You shouldn't just suddenly lose your balance. And that can be room spinning, like you just got off an amusement park ride, but you were just sitting here. If you're walking, especially if you feel pulled to one side, that's not normal, especially if it happens all of a sudden. So we say B is balance, watch out for a sudden change in balance. E is eyes, so if you suddenly lose your vision, vision loss should be slow and steady, right? So we shouldn't suddenly lose vision. If one eye is suddenly blind, that's an eyeball stroke until proven otherwise. If we suddenly can't see the right side of our world, that's concerning. Our eyeballs are fine, but the brain has to interpret what we see. So if we suddenly are losing an entire half of our world, that's a stroke until proven otherwise. Okay. And of course, double vision. So every once in a while you can see a stroke patient and their eyes aren't lining up. And that's not normal, especially if it just happened all of a sudden. So eyes are a good sign of stroke if your eyes or your vision suddenly change. F is for face, so that's the more common symptom. We all know a face droop can be a sign of stroke. But that's a more obvious one to just suddenly say time to go to the ER. A is arms. So if you suddenly lose an arm in terms of strength or sensation, but if you're walking around, no injury, and you can't use your pencil to write, you can't use your hand to text, that should never happen all of a sudden. I always say strokes are painless, right? So anytime somebody has a painless loss of their strength or their sensation, that's very concerning for a stroke. It's a painless use of a limb, and it goes for the legs too, but we say arms just to kind of remind us.
Okay.
The S in B.E.F.A.S.T is speech. So you and I are talking just fine, but if I suddenly was slurring my speech, once again, not drunk, that's a concern. You should never be slurring your speech, for no reason. But also speech can be affected in that if I wanted to say, your pants are black, and all of a sudden I'm like, pants.
Okay.
Kind of losing that, I know what I want to say.
But you can't say it.
Right, I know what I want to say, but I can't get it out. And that's actually very scary. Stroke patients say, the entire time I was having my stroke, I knew what I wanted to say and I could not get it out. And you can just see it in their eyes, they're horrified by it.
Oh my goodness.
But that's a change in speech to look out for. And then of course the gibberish. So when you can have a stroke that affects your speech, and I'm talking to you just like this, and to me, I think I'm speaking just fine, but to you, it's nonsense words coming out. And you're the one who's usually concerned in that scenario.
Okay.
Because I don't realize I'm speaking just complete nonsense. To me, I think I'm saying your pants are black.
Yeah.
But you're like, she just said yellow, purple banana. And then the last one is time. So time. So with strokes, the biggest thing is getting to the ER as fast as you can. Because every minute that you're having a stroke is time that your brain is not getting blood. And the brain cannot regenerate. It's not like skin where you get a cut and you can heal. When you don't have blood flow to your brain, it is dying and it is not recoverable. So the quickest you get to the ER, the quicker we can, confirm that yes, this looks like a stroke. Yes, this seems to have happened very recently. We think we can or can't give you a medication that gives you a 30% chance of reversing it. Or if it's a really big stroke, we can actually get you to a center that can physically go in and pull out the blood clot that's causing your stroke and minimize that permanent damage.
Okay. Is there any preventative measures we can take to not have a stroke?
Right. That would be ideal, right?
Yeah.
It's best to prevent than to have to rescue.
Yeah.
The biggest thing, we live in the South, is fighting some of the cultural tendencies that can get us. The fried food, the high salt, the high sugar, and the things that come with that. And smoking, do not smoke. Nobody in this day and age should be smoking.
That's very true.
It's just the bottom line. I know we come from the South. My dad, he worked on the tobacco farms. I get it. Mm-hmm. I know that it's deep-rooted, but at this point, it's a different day and age. It's time to quit.
And we know now what can happen.
We know,
yeah. You're absolutely right. And I will put below the resources that people can look into if they want to find out more information. Dr. Hannah, thank you so much for joining us and telling us all this educational stuff that we really do need to hear.
Thank you for having me.
Awesome. We are back after this.